Let's see. You hear me at all, Brandon?
Oh, yeah. Do you hear me? Can you hear me?
Maybe in the room without having my face on camera.
I don't know.
You're the face of all of us,
Ty, can you hear me?
Good morning, this is Virginia Barnes with Lacrosse and Blue Shield, Kansas.
Oh, you can jump on there too if you want to.
Can you hear me?
I can hear you.
Still nothing,
All
Brandon.
right.
Can you hear me?
Yes.
I'm just not getting any sound through. Hey, Brandon.
All right.
All right. Can you hear me now?
That's you, right?
Yep, I can hear you.
All right.
All right. Well, guess we're good to go. All right. Tiffany can hear me.
Yeah, I can hear you, Brandon.
Great.
Great.
You may want to mute your speakers. You can't hear me.
No,
No.
I just muted my speakers.
Cool.
Well, you can leave your mic there.
Right, and that's where.
I will stay out.
No, you're fine. I'm not good with this type of stuff. My computer's the one that's hearing Brandon.
Is your mic on though? Did he hear you?
So, yeah.
Cool.
Who's that?
Who's that?
I'm muted. Okay. Can you hear Brandon?
speaker off?
Ty, I can hear
Ty, I
you
can hear
just
you
fine.
just fine.
Oh, yours is the only one that's live right now.
Oh, that's weird.
Yeah.
And
I can hear Tiffany.
I don't know if
I don't know if Jenny is.
Looks like she's
Looks like she's on mute, actually.
Brandon, this is Jessica. Can you hear me?
Yeah.
Yeah.
Are you no?
You guys have like
You
a
guys
little
have like a
round
little
table
round table
microphone going or
microphone
something?
going?
Hey, Brandon, this is Candy. I just signed in by phone.
Oh, great.
Oh, great.
Hey, Candy.
Hey, Candy.
Hello.
This is Virginia. I'm also only on by phone.
Hi, Virginia.
Hi, Virginia. Great.
Nice
Nice,
powwow
powwow going here.
You have a
1,
slight
2, 3, 4, 5, 6, 7, 8, 9, 10.
Well, I got 10:33. Ty, what do you think? You want to get it?
You want to get it
Going?
going here?
Brandon, this is Jessica. You have an echo coming through. I'm not sure what it is, but we keep hearing an echo.
I do too.
I do too.
I'm not really sure
what to do about it. Okay, how about now?
Better.
All right. So shall we get started?
Yeah, sounds good.
All right. Cool. There's no real sort of clear facilitation plan in place here, but the title of the session kind of explains it all. It's really an opportunity to talk more about what kinds of community training and capacity building opportunities there are, or that liaisons are sensing that there needs to be in order to do the work that you're doing. And so just to give you an example from my experience here, before we open it up to everybody else, and hear more about what kinds of tools or trainings and other capacity building kinds of things might be most valuable to you. So I just had a meeting last night with our priority population, and there's our priority population is defined geographically. It's a neighborhood in Manhattan that's been traditionally underserved. Not a whole lot of biking and walking infrastructure, not a whole lot of transportation. It's also a food desert. If there is a such thing as a childcare desert, it's definitely one of those as well. Not a lot of street lights and stuff. And there's also not a lot of community space there. There's no community center. In fact, we meet in a church, which thus far has seemed to be fine, but it's also not. For some people, meeting in a church can be a barrier. And so, one thing that's on the table right now in the neighborhood is there's actually 2 schools in the neighborhood. One is elementary school. The other one's a middle school. And the city, Parks and Rec and the city kind of together are building a rec center. And this is going to be like a 2-year sort of design process before they actually start building it. And there's a whole steering committee of community members who are informing the design of this rec center. And so most of it's basically the sort of common understanding that this rec center is really, given the sort of influence of the city and the school system in this rec center, is really meant to largely be like more gym space, and space for youth to practice, play sports and that kind of thing. And yet, if you ask people in the neighborhood about that, what is needed in the neighborhood, they'll say, well, we need community space. We need, a place where we can watch, maybe a cultural sort of space, a place where, kids can come and just hang out and watch movies, play video games, play pool, place where, programming, educational programming, community-based educational programming could be done through. And so the priority population that we've been meeting with has been saying, well, how do we get from extra gym space to community space, right? Like, how do we influence that, that decision-making process? And so as far as, trainings and capacity, building goes, we've been saying, well, what's it going to take to get, to achieve that kind of goal? And so this in our minds has been, just a basic community organizing, sort of grassroots community organizing sort of project, this rec center that is. And so, what kind of tools can we put in the room, and what kinds of experiences can we give the priority population to, guide them through this process? And also, how do we community liaisons, equip ourselves to be able to do that effectively? And so again, just basic community organizing training has surfaced as something as that would be a really valuable tool. And I know that the Health Foundation has supported those kinds of trainings through Wellstone in the past. And so the point of this conversation is really just to ask, well, what kinds of tools and capacities are you recognizing that priority populations and your leadership teams might need in order to make progress on what's happening in your community? And I think I'll just leave it at that and see where we go.
Brandon, can you hear me okay?
Yeah.
Okay, just wanted to make sure. So, Brandon, when we talked a couple of weeks ago with your leadership team, I guess it was more your project team. It would have been Jennifer Green and Julie Hedinger. You were just kind of asking who's doing community conversations well, like who's facilitating or who's been involved with meetings in the community where good interaction has taken place, where trust has been developed and just fellowship has been had, and there's just been good two-way communication. It sounds like that's one thing that you were interested in hearing from others. Is that right?
Yeah, for sure.
Yeah.
For
So
sure.
everybody has like stories of success, stories of failure, which are just as good as long as you're willing to grow from those. Jump out and let's talk about it. We got some time carved out today to just have that conversation.
Great.
Can you guys hear me?
Yeah. Is that Damaris?
I'm sorry that I'm coming on late and that I'm having video issues here. I will get it in a second. Okay. Okay. Hi.
Hey. So I've not heard anyone else's voice other than Brandon or Damaris. I see a few microphones muted still. If you're trying to talk, we haven't heard you. So feel free to jump in. I'm picking on Travis Rickford in a private chat to try to encourage him to share a story from Northwest Kansas a few weeks ago.
I thought maybe I put it down on my calendar. I don't see it there. I just put that very.
Can you all hear me okay? This is Travis.
Yeah.
Sure.
Hey, Travis.
Yeah, sorry about that. I'm right there with Damaris with some technical issues on this Friday morning. I'm taking the call from my cell phone.
What is her name? Kristen?
We recently had a community conversation in Hoxie a few weeks ago. And before the community conversation, we had worked with the health department to identify families that they had been working with through their WIC program. And so we did it more of a personal invitation on their end.
145 South 9th Street.
Sorry, someone's not on mute.
It's at the very
Yeah, if you're not Travis, could you mute?
Oh, sure.
I can hear someone whispering.
Okay, I think that's better now. So in any event, we scheduled a community conversation. We worked with the health department to make personal invitations to WIC families, and we had 4 or 5 WIC families that were registered to attend. We created an internal agenda, and Damaris is probably familiar with how this is going to roll, but we created an internal agenda. We tried to really be specific about the questions that we asked, because the goal of the community conversation was to, find out, what the root of the health inequity was in Hoxie. We weren't quite clear on what that looked like and wanted to do some more fact finding. So anyway, we showed up at the community conversation. We had 7 individuals there, but we ran into a problem. We didn't have any members of what we considered the priority population to show up for the meeting. We went forward. We moved ahead with the community conversation as planned, but and we found out some interesting things that we didn't before. But as we closed the meeting, we had a conversation about how we could bring these people to the table and why they didn't show up after they had been offered, $50 to attend. Childcare was available. We had food there. We did all of the right things, but still no one was there. So we came to the conclusion that, all of us being members of organizations, we had 2 of us there from my organization. We had the superintendent of schools there. We had the hospital there. We had the health department, obviously, and someone running for a local county seat, and then someone from a faith organization. And so we came to the conclusion that why would they come to a meeting where all of us were white, middle class, and may not completely understand what they're going through. So we decided that a little bit of relationship building was in order, and we left that meeting talking about ways that we could talk about health inequity different than a community conversation. And a lot of that involved finding ways to build that personal relationship within the health department while they're there for their visit. But also it kind of made us look at the whole idea of the community conversation for the other 4 counties that we're working in a little bit differently. So I'm rambling a little bit here, but that's kind of one of the issues that we ran into, and what we're trying to do is model things that involve building relationships more than just coming in with the community conversation. And Ty, I'm not even sure I addressed the question accurately, so forgive me and feel free to follow up with any questions.
No, I think you did. You said that some of the challenges and lessons learned from Hoxie are informing what you're doing in other communities. What exactly does that mean?
Yeah, so the following week we met with our leadership team in Sharon Springs, which is in Wallace County. And actually backing up a little bit, right after the HCI meeting, I came back to the office kind of in a funk. I was like, what do we do? This community conversation, obviously didn't work. We found out some cool things, but hold on just a moment. So I brought my home visiting director into the room and was talking to her about it. And she has a lot of experience working with families that we're trying to reach with this work. And she goes, when I first read about that community conversation in your action plan, I kind of told myself that, why is he doing that? That's not going to work. So then I was like, okay, so what do we do? And she goes, we need to have the conversation deeper than that. Someone that's going through those issues is not going to show up at a community conversation and talk to you openly about them. They have to feel like they can trust you with that information before you can even begin to have those types of conversations. So we talked about looking at our priority population a little bit different. And at that moment, we decided during our current home visiting structure, we would add some space where the cameras are turned off because they need to have cameras in the situations, and our home visitors could talk to them about, deeper things that they're seeing in the community in terms of health and equity. A week later, I was in Sharon Springs to visit with their leadership team. And one thing that I didn't do in HCI that I'm doing in Sharon Springs is we're formulating the questions a little bit different, or trying to find a way similar to what Damaris and I did with the Community Engagement Initiative to have the residents kind of take the lead while I provide the support. And so right now I'm working with their local food bank board, which is comprised of residents, and getting their approval on the questions and the formatting that we'll use, and having them actually plan out what the best way for them is to tell us what we need to know. So that's where we are at this point.
So that's a story, just about engagement. And the real focus for today was engagement, yes, but also what's happening related to training. Reno County, for example, has done some leadership training using some of the Kansas Leadership Center principles, and then also just other types of capacity building. So Travis, I think what you're sharing is kind of general to engagement, but then, how are others building on that with identifying what training needs are, and then how does that even happen? How does that start to take shape? So any reactions to Travis or any other stories around engagement or training, capacity building for or with alongside community members? Would love to hear anything.
I'd like to talk if anybody, or I'd like to jump in. Can you guys hear me okay?
Mm-hmm.
Okay. One of my grant objectives is to have more civic engagement. And so what we're wanting is to get residents to understand what it means to run for city council, if they're interested. Also how to pitch, a couple things. How to pitch in front of their city council about issues that are important to them. That's one. Another is to basically recruit residents that might be interested in running for city council. That is the second thing. We want them to run. And so what we're doing is we're collaborating with the League of Municipalities right now to design what it would look like to basically go from resident to mayor, and a class on that. So our hope is to have it's in the very beginning part of it right now. It's going to be a pilot program in Allen County, and if it does what we're hoping it will do, we'll present it next fall at their League of Municipalities conference. But it's kind of like just figuring out what it is if I'm a resident and I have no idea what parliamentary procedure is or anything, but I've gone to a meeting before, or I want to go to a meeting. It's like how I present, and then if it sparks something in me, how do I run? And then providing them, even just with the technical part of it, of like, here's the paperwork that you need, kind of thing. So that's what we're working on right now to hopefully have the first class will be in November, and then another class in February and another in April, and with the hopes that at that point somebody will have felt enough leadership building within them to put their name in the hat for the November. Yeah.
Damaris, this is Margaret.
Yes.
Can everyone hear me?
Mm-hmm.
How long
Yep.
I may have missed it, but how long are these classes going to be, and how many people are you anticipating?
Well, we're in the middle of designing it right now. We're actually using residents from across the county, not just La Harpe, but where other residents have had questions. So we've got a lady from Savinburg, one from Humboldt, who is on the city council right now, and then a resident from La Harpe, and that's part of the design team. So the residents are helping us design it, because I don't even know what questions to ask. So they're going to help with that part of it. And the training will be a 3-hour training in the evening, which we will provide dinner, and just understanding that it is so stripped down that we will be writing it like a 3rd to 5th grade reading level. This is for, and that is not to make an assumption that that's where our residents are with literacy, but just saying that it has to be really stripped down for it to be palatable, and we want them to walk away feeling like they've learned something. But we'll have 3 and then my hope is to have 10 people in each class. I don't know if I'll get that many. The League of Municipalities actually has a so I made it to city. So now I'm a city council member. Now what class? Basically, they have that class. So this class will go from, if I was never on city council or never involved, to maybe just a little bit of crossover into I made it to city council. Now what? That'll lead into that. Because I actually have city council members that are new to, or one of them actually isn't that new, but she still doesn't understand what it means to be a city council member. So she wants I'll open it up to all of the city councils in the county and all the residents. So my hope would be to have 10. I mean, I would hope the mayors in the communities would just say, I'd like somebody from each city council member, our city council, to attend this just to brush up, because there's an opportunity for them to go to this training every fall. But the city council, sometimes people from a municipality go and sometimes they don't. It's just but this way we're going to bring it here.
So I just wanted to, this is Brandon, reflect on what Travis said and is going on in his community, which I think is awesome. By the way, I think, and I don't know that I'm going to identify any sort of particular training, opportunity or need here, but Travis was talking about the challenge of engaging the priority population and building trust there. And there was a speaker that came to K-State a few months ago, and I forget her name, but she's actually like a really well-known activist. She was very active during the civil rights movement and did this authentic engagement kind of work in communities where trust didn't exist before. And she said something. One of the things that she said that stuck with me was that she said you're gonna have to go to the same house at least 6 times before like somebody really trusts you. And this was a woman who herself, right, like was experiencing was experiencing racism and inequity on all kinds of fronts, and you would think like had some common ground to sit on with, perhaps some of the people that she was organizing with. And yet coming from her, she's even saying like, you like it's a very deliberate and, long process to get to that point. And so I've been thinking about what that looks like in our community. And, I think, some of our most vulnerable populations in the neighborhood and the ones that are experiencing the health inequities tend to be concentrated, I think, within the mobile home parks. And, I'll go to those places like or to the same people's, homes like 2 or 3 times. And, I've made some asks like, hey, would you be interested in coming to this neighborhood meeting? And of course, you still don't see, some of those people showing up there either. So I think it's just good learning in terms of what the authentic engagement, can look like, and sort of recalibrating expectations about, how long it takes to build that trust and what it means to meet people where they're at. So I just really appreciated what Travis shared. Hey everyone, I'm getting a message on my screen, on my Zoom screen. It says your free meeting will end in 10 minutes. Please upgrade to a paid account at $15 a month for unlimited minutes. So I'll be doing this in the background here in Billing, Kansas Health Foundation. So.
We're working on Zoom capacity here. This is nice. I mean, I like it. It's good interaction. I like the video, and the chat's nice as well.
Ty, is this your first time getting to do the Zoom then?
No.
Okay.
No. With a large group, I mean, there's like 12 people on or plus, and yeah. Yep.
I don't want to take up everybody's time, huh?
Damaris, this is Travis.
Hi, Travis.
I love what you're doing there. That's awesome, and I hope we can talk more about that later in our project, because we may find that relates to some of our issues. So
I hope it works. Yeah.
So one thing, Brandon, I'm just going to find one of our conference call lines that's available right now, and then I'll post that in the chat. So when the time does run out in about 8 minutes, if anybody wants to continue the conversation for a few more minutes, you can just jump on that, if that's of interest.
I should have this up and running in a couple of minutes here. So.
Oh yeah, either way. Either way.
Okay.
But I was going to mention, so Travis, thanks for sharing just kind of your engagement story. Damaris, kind of you spoke to a specific training opportunity working with your priority population. I mean, I'd love to hear, I see a lot of folks on the call. Love to hear any other stories about, what training needs have been identified. Are you making progress on arranging for training? What's the relationship between the identified training and your community action plan? And I also see some advisors, some of the HCI project advisory team on. I see Andy Brown from KDADS. I know you do a lot of technical support, capacity building for related work across the state. Would love your input. Kaisa, I see you on as well. So love to hear any ideas or reactions.
This is Jenny from Jewell County, up in the Mitchell County Health Foundation area, North Central Kansas. What I'm seeing is that we have a lot of kind of what Damaris was talking about with training city councils. My city council, and it wasn't my guess that it would be the issue when I walked in, would be that the city council needs more training. But as they talked about the priority population talked about what challenges they have, it became very clear. that we needed to get a better grasp on what the city
Mhm.
council does know. They need better education, especially about their budgets, because a lot of the issues in town are directly related to that. Most of the time, the cop-out answer is, well, we don't have money for that. So I needed to know, is it truly that the city does not have any budget or money for that? Or is it that they don't know how to shuffle and get certain grants for things that could have gotten grants for, so that more budget would be freed up to solve some of these problems that the priority population is looking at. So I just thought that was an interesting takeaway. We're doing some training, trying to push for some Kansas League of Municipalities training for them, so that, and I got another city council member on board, so that we have majority on city council, because that's important too, that things will not be voted on and go through if you do not have majority support. So it's important to have people who understand the issues and can help guide that conversation and push things through that are important. So.
Awesome, Jenny. It sounds like you and I are going to get to know each other well.
Yeah, exactly.
One other thing I'll mention that I'm reminded of is Jenny and Damaris talk about their civic training program. We're also recognizing in our priority population group, the city has come in, Parks and Rec has come in multiple times and shared information on like what kinds of projects are going on in the neighborhood and what's in the future, for infrastructure projects and all kinds of information that people just can't, keep in their head. It's one of these things that just constantly comes up in these meetings. Like, yeah, we talked about that a couple of months ago. And, of course, new people come in, people come and go. And so the group decided to start to put together like little 3-ring binders for anybody who's a member of the priority population. In this case, they're emerging neighborhood association, and one of the sections that they are in that's in development is sort of like a civics 101 or local government 101. Like how does government work in Manhattan? Where do decisions get made? How do things get on the agenda? And those kinds of things, which I think is very similar to what you're talking about. But now it's in this group, it'll be something that's archived and democratized, like across the people in the room. Now, I don't know that there's going to be a whole like training program, on all of that. I mean, I could foresee that, but at least they have like some tools at their disposal that they can review, or they will, so that they can review on their own, and then when it comes up, they can access those.
I want to follow up too. I know we're kind of talking about the civic engagement stuff. Another part of that with the residents, training them to be able to be leaders on the city council was also just to teach them how to be able to pitch in front of the city council, so that there's kind of a structure around that. And just to throw out a resource would be that, and I think Brandon has gone to this training too, the Midwest Academy, Mobilizing for Social Change, or Organizing for Social Change, I'm sorry. I went to that training and we got a really great book, and just in a real technical way, there's a pretty basic template in there, and that'll be something that we share with the residents, so that just as an exercise for everybody to do as to be able to present in front of the city council. That's actually one of my SMART objectives, to try to see if I can encourage and support several residents to present in front of council.
That's an interesting, just presenting in front of the council. That's something I've heard from another community recently, where the community liaison was working with some members of the population affected by the inequity issue that they've identified, and kind of encouraged them to show up in front of some policymakers. And I don't know if it went as well as they had hoped it would go, but just kind of speaks to that need for, that really is something you have to plan for. And there are some specific methods that work. There's a way to communicate effectively with policymakers. So yeah, that's
we have that broken down to like besides that template, like writing a script for the residents, role playing, like we'll have our own little role play before they ever do it, like actually making sure there's practice before they go do that and stuff like that, giving them the space for that practice to happen before they get up there.
Mm-hmm. Yes. Also reminds me, Kaisa, of the workshop that you walked us through in Salina back in March, just kind of the role playing that you had us do. And I mean, role playing can be, I think, a pretty effective tool for, in the community setting.
Well, I think too, this is Jenny, I think too that, I don't know, I kind of went around, I know the community well enough that I don't want to say hand-picked, but I kind of knew who would have the already existing knowledge enough to be on city council and be effective. And so I chose people to specifically go and talk to about running for city council. And then also, I think some of it too is just having the wherewithal to withstand some of the storms, dealing with government and city councils and stuff like that. I mean, you hit walls and to know you can bounce back and you can go back and reformat and come back and not just give up. There's one guy that's on city council now. He was on city council before and he got frustrated and gave up, and then he wouldn't be on it again. And then I had to be like, okay, wait a minute. You can't blame it on the mayor. The mayor doesn't have a vote. Just educating him on, you can get this by with majority. Everybody does not have to agree on this. If you make a good case and you can get almost everybody to agree, that's what you need. The mayor just has a tie vote. I mean, things like that he didn't even realize. And so it's like, don't give up. Keep at it. You just need to go at it a different way, or you need to reformat and come back. That kind of conversation has been helpful, I think, to people too.
Jenny, what county are you?
Jewel County.
Okay. So you're on Shelby's team.
Mm-hmm.
Okay.
Yep.
I don't see Jackson on, but I know they've done some work there in Reno County. I'm just looking at some of the other community liaisons that are on. I'm not sure that I recall seeing any specific training being provided. So for those that are on that aren't speaking up yet, do you have questions about this topic? Is there anything you're wrestling with or starting to plan for, like in year 2, around training type work with your priority population? We'd love to hear from you.
So I'll speak up I don't want to take over the meeting. I'm just excited about the work that we're doing, but there's another topic. Is anybody else going to share?
I'm not seeing much in the chat. I'd say go for it, Damaris.
What we're trying to work on with sustainability, part of it is grant writing training for residents. We're identifying residents in the community that are interested in learning how to write grants, but really just specifically a couple of different ways, setting up a grant calendar for the grants that are available over the course of the year, and what their deadlines are and what they will fund. And that's the first part of it. And then developing a storyline, basically like a template with the statistics and the narratives and that can be used multiple times throughout, so that every grant's not written completely from scratch. And then gathering that team of residents that are interested in learning. So the only grant that I know that actually offers TA that I've worked with, and I'm sure there's plenty more, is the Healthcare Foundation of Greater Kansas City will allow for technical assistance. I think maybe even up to 8 hours worth of that when you're writing a grant. So we'll get the people that are interested in that to set up an 8-hour calendar over the course of the next several months with a goal that they can submit a grant in probably April for this. But with that learning process, knowing that they've got this information now that they can put towards the other grants that are coming up and available. So that's the training that we're working on, making sure that when Thrive leaves La Harpe, that there are writers and also a know-how of where to look for the money.
So when you think about the community conditions, the 5 community conditions on the theory of change, and we say like if the community can make progress in these 5 areas, then we think they're going to move closer to the outcomes that we're looking for with HCI. Do you feel like that grant writing piece, does that fit like into the sustainability bucket? Okay, so along with other strategies like trying to secure, other investments in that community, like you've done in the past in Allen County. Okay,
yes.
That makes sense.
Everybody always asks us how to write a grant. So like we live in this community where they're all asking us that, so the goal for that one is just to kind of develop a team that's in that little pocket geographical space that has the know-how. And then they can share that with their community peers over in Savinburg, or, we have a lot of Pride programs here. So those are small grants, like $2,000 to $15,000 grants that can go just for community beautification projects and stuff like that aren't a very intensive grant writing experience. So it's like, the template's relatively easy.
Yeah, sustainability is a condition where it seems like some of the communities are struggling. There's just not a lot of activity there. It's nice that you mentioned grant writing, because I think that's kind of something that people can kind of wrap their arms around and understand and think about how that fits in their kind of sustainability work.
Yeah, I think a useful, maybe, I'd like to hear from some other people as well. And I think a useful way to think about this training, capacity, building and needs is, if you walked away, if the community liaison walked away, what would happen amongst the priority population? Right? Would it, what would be the first thing that falls down, if anything?
This
Who's
is
on the
Seth
call
sitting
still?
by
I'm like,
Wichita State. I'll just remind you all that failure stories are very useful for learning.
So if I had asked that question to myself, let's say in January, the first thing that would have fallen down would be they would no longer meet. The priority population would no longer convene. And that to me would have pointed out a need for community, relationships among the priority population, leadership among the priority population, and thinking about it in that way. I would say, well, in terms of training and capacity, I wish I would have spent more time creating like a internal infrastructure and relationships and that kind of just group capacity among the priority population, whatever that
I'm curious, and I know we're running close to time, and appreciate the different voices we've heard so far. This has been really good. I'm curious though, how do you view your role as a CL, or what is your role as a CL in getting the community to talk about what's needed in terms of capacity building? Because certainly you probably aren't just going in and saying, let's do this, let's do that, we're bringing this training in. There's some sort of two-way communication. So how do you view your role? What have conversations looked like between yourself and the population you're working with?
I'll talk. So we had real talks, what we called real talks, and that is basically a one-on-one conversation. Each one of those real talks, I didn't know people in Maharp, so I was learning who was there, and and then when we'd leave this real talk, I'd be like, well, who's one of your friends? Can you introduce me to somebody, or things like that. So that's kind of how I started, to me, kind of getting into the neighborhood or into the community, and then just asking a lot of questions. Relationship building was happening in the middle of those real talks, and so that's how we found out what they wanted. Besides the real talks, we kind of went through a couple of the other processes. We sent out a confidential survey to every house in the town, which is like 270 homes, with a self-addressed envelope for them to be able to stamp so that they could send that back to us, to Thrive, not to their city. So it was confidential. And then we did and then we also had a community conversation. So in those three ways of collecting thoughts from the residents, then we added those all together to kind of show what every idea that was up there has been reported back to their city council of everything that was identified. I did a report for them and everything. And then, so that's how we figured that out. There's a lot of things on that list, so I'm not sure if I'm trying to find out more, because there's so much on this list that I definitely think there's a health and equity issues on that list that I'd like to peck away at, not go down the rabbit hole of there's one vote for somebody that they wanted to raise the speed limit in town. And I'm probably not going to put a lot of energy behind that one person. And whenever they saw the report, everybody knew who it was, because this guy talks about the speed limit being too low all the time, so there is that. And then we're just kind of pushing forward for a visual. We have a map making machine here at work. I want to take all of those priorities that they identified and turn it into a cool poster just to hang it at City Hall that says, here's all the things you guys have been saying, and if you're interested in it, just write your name underneath that, so I can find you and talk to you about it more. So I can start almost dividing the town based off of their interests, of like finding little subgroups that way. And then maybe create that little grant thermometer, so they can see that they're starting to get grants in based off of the things that they've identified to be working on in their community. That's what's been spinning around in my head lately.
That's helpful.
I can say there isn't anything on that list that came from me or Thrive. And that's I can absolutely say there is definitely a health and equity issue over there with their sewage that they didn't identify. So like in my head, I'm like, I really need to work on the sewage, but I'm chasing their thoughts. And even though I feel a little pulled.
So Ty, this is Andy. Can you hear me?
Yeah, sure can, Andy.
I'm going to try doing a screen share and see if that works. Okay. Can you guys see that now?
For sure.
Okay. So when we look at capacity building with the Kansas Prevention Collaborative, this is really like a very specific phase in our strategic prevention framework. And so there is this sort of existing framework that we can work with communities on. And it involves kind of locating and engaging specific community members from 12 different community sectors. And then kind of going through an assessment that measures the capacity that that particular community has to address things in terms of readiness, and also in having their resources available to do the work that they want to do. And so a lot of the discussion I've heard today, I think, is pretty spot on in terms of making sure that you're getting out into the communities and developing those relationships, and identify what that and goals are is very critical. And I wanted to also just share, this is on our Kansas Prevention Collaborative website, which is just kansaspreventioncollaborative.org. And there are some additional resources over here that are available to, through Kansas, and are also county resources that you can look at in that regard. Also, Kansas is home to something that's called the Community Toolbox that is available through KU. We use this a lot with the collaborative, and it supports communities. And so they have capacity building trainings that are available through the KU Center for Community Health and Development. And those vary from things that are like in-person workshops to like train the trainer type things. So that might be something that Kansas Health Foundation and maybe the community leaders might want to explore, is looking at whether or not some of these online courses or conference things might be something that they want to engage in around capacity building. So that's a cool resource that we have here in Kansas that's local. And then also, this is a little, again, kind of a prevention focused resource, but I would say it could be generally applied to all sorts of other community engagement work, right? So this is a capacity primer that's available for download through CADCA. The Department of Aging and Disability Services is a sustaining member of CADCA, and they have all sorts of resources and things available, but this one's specific to capacity building, and looks at how to help coalitions build capacity in terms of membership and leadership. So those are things I thought I would share with you guys that are on the call today. And then, Ty, if you want some help putting together some other resource lists, I could probably help do that too.
That's helpful, Andy. Thanks for sharing those.
Yeah.
And Andy, can you just tell people a little bit about what you do with a prevention program?
Sure. So I work at the KDAD's Department for Aging and Disability Services, and I'm the prevention program manager, which means that I'm responsible for helping people, and by people I really mean communities in Kansas, helping people prevent underage drinking, underage tobacco use, drugs and other alcohol, or alcohol and other drugs, that substance abuse, in all sorts of populations. So like in a few weeks, I'll be having a summit on substance abuse in older Kansans. Sometimes we look at specific drugs and specific populations in the state. Sometimes we look at things on a regional basis. But one of the things that we're responsible for is kind of the oversight and administration of the Kansas Prevention Collaborative. And so we have we provide essentially some funding. It's fairly limited, but some funding to communities directly in order for them to be able to do prevention work in their communities. And the way we've structured that is that they receive a year of planning funding and then 3 years of implementation funding. And our hope and intention is that during those funded years with the Kansas Prevention Collaborative, that they're able to build enough capacity to apply for drug-free community grants from the federal government, which then brings about $1 million over the course of like 10 years into the community to do prevention work.
That's great.
Yep.
So more than likely across the 18 HCI communities, community liaisons are probably interacting with prevention coalitions that you work with or support.
Yeah, it depends on what counties you're operating in, but we do have some that are up and running around the state.
Yeah.
So this map here is our KPC coalition map, and not all of these coalitions are funded. So you kind of have to look at sort of, these are our KDAS regions. We have a behavioral health technical and training assistant contract with DECA, and so DECA provides services in these regions. And then you can also kind of look at this by funding. So if you wanted to see where we're currently funding implementation grants, these are the communities that we're doing that in at the moment. And our planning grantees, if I add those are these little pink ones that show up here. So we've got Barber County. We've got somebody out in Grant that's new this year. We got Prairie Brand Potawatomi Nation this year that's new, and then Donovan County that's new. And so we'll be certainly interested in collaborating and participating with folks. So, and you can come to this map and basically, figure out what region you're in. So like if you wanted to see who's at Barber County United, there's contact information for them. You could reach out to them directly.
Very cool.
Yep.
And we just proved, Brandon, that we can do the screen share on Zoom also. So thanks.
Yeah, great.
Screen shares are wonderful things. I like them. And then also, guys, just so that you know, if there's anything that you are interested in around prevention, we do have a e-learning portal that you can just reach into and pull up different topics. So we have sort of a monthly prevention talks where we talk about different subjects. There's also specific information on the framework. So within this document or training platform, you can go to the capacity and it'll offer you kind of an online primer on capacity building.
Very cool.
Yep. So feel free to explore what we've got out there. We don't generally charge for any of it. The exception for that right now is we're trying to put on a statewide conference in September, and so there is an admission for that. But lots of resources, and I'm happy to share them. And you can reach me at andrew.brown@ks.gov.
Yeah, thanks, Andrew. I'm definitely going to be checking that out. It looks like a really great resource. We are at time boundary here, so we should probably wrap this up. I see a couple of people had to jet anyways, and so just a reminder that on Monday for community liaisons, we'll have our Zoom conference call. And I sent out an email yesterday with a couple of prompts to think about sharing action plans as a way of learning about what's happening in other communities, what's working, and how you're thinking about strategy really in developing those or doing work in the 5 areas, and then also thinking about doing place-based work, geographically sort of defining priority populations or priority populations within geographic areas and what the value of that is. And I know Donna Young had some ideas about that she shared with me about the work that's going on in Wyandotte. So I'd be happy to share that with everyone on Monday as well. So with that, I think we can start to wrap up here. Anything else, Ty or Damaris?
No. Are you going to send a link out to everybody, or just as people ask, as far as the recorded conversation?
I'll blast that out. I'll just send it to everybody if that's cool with the people here.
Yep. Let's do this again. Different topic, different day.
Great.
Yeah.
Thank you
good.
so much.
All right. Ciao.
Bye, everybody.